Hello students. Today our topic is pharmaceutical care concept. Before starting what is pharmaceutical care and what are the concept of pharmaceutical care, I want to tell you what is the origin of pharmaceutical care. So this concept of pharmaceutical care originated in the United States in 1970s and 80s as the pharmacy profession shifted its focus from dispensing drugs to the patient-centered care. So the early definition in 1970s and 80s discussed safe drug use and patient needs. In 1970, Dr. Donald Brody's work in 1973 and Michael and his colleagues in 1975, and they told this pharmaceutical care patient-centered approach to the pharmacy. 1980s, Charles Hepler defined it as a covenantal relationship, like a mutual commitment between a pharmacist and the patient. 1990, Hepler and Linda Stans, they define it's a highly responsible drug therapy for improving patient quality of life. Early 1990s, key pharmacy organizations like American Society of Health System Pharmacists, ASHP, and American Association of College of Pharmacy, AACP, adopted the Hapler and Stan definition in 1992. 1998, the International Pharmaceutical Federation, FIP, included maintaining quality of life in its definition. And 2013, Pharmaceutical Care Network Europe, PCNE, described it as the pharmacist's role in optimizing medicine use and improving health outcomes. Then coming to the pharmaceutical care plan. So the pharmaceutical care plan is a process through which a pharmacist cooperates with the patient and other professionals in designing, implementation and monitoring a therapeutic plan that will produce specific therapeutic outcomes for the patient. So the medication related pharmaceutical care involves not only the medication therapy but also the decision about medication use for individual patients as well as judgment about medication selection, doses, routes and method of administration, medication therapy monitoring and the provision of medication related information and counseling to the individual patients. Next, care. So the concept of care is caring, a personal concern for the well-being of another person, which consists of medical care, nursing care and pharmaceutical care. And to this pharmaceutical care, however, the pharmacists contribute unique knowledge and skills to ensure optimal outcome from the use of medications. The pharmacists cooperate directly with other professionals and the patient in designing, implementing and monitoring a therapeutic plan that improve the patient quality of life. And the outcomes, it's a goal of pharmaceutical care to improve an individual patient quality of life. And the outcomes is cure of a patient disease, slowing of a disease process and the prevention of disease. So the pharmaceutical care, including this care plan process like CORE, CORE, PRIME, PRIME, FARM, FARM, and SOAP, SOAP, is a systemic method for recording the pharmacist's examination of a patient, pharmacotherapy, and subsequent identification of a medication-related problems, which includes whenever a pharmacist go and see the patient file, so he has to first collect the data, which is a very important part. And the data doesn't mean that it's only patient details like age, etc. No, it includes everything: the demographic data, vitals, history, the patient condition, chief complaints. It includes past history, past medication history, social history, each and everything related to patient which has to be addressed. interpret that data, whatever the pharmacist collected, identify any drug related problems, determine any priority of drug related problems, what has to be addressed first, determine the desired outcomes, develop a therapeutic plan, develop a monitoring plan. Monitoring plan includes once the disease got cured, the patient is fine, but again, the monitoring is important. The patient has to monitor his own condition. The pharmacist has to tell patient how he has to do it, what are the points he has to check. If a BP patient is there, he has to check his BP. It's not like after 6 months or 1 year, but when, how frequently, all these details. Then implement and follow up a pharmaceutical care plan. So second one is prime, PRIME. P, pharmaceutical based problems. So incorrect dose, route, duration, incorrect form, incorrect frequency, all these details will come in this. R, risk of the patient. Any contraindication, any patient medication allergy, any drug induced problem, any common serious side effects. I, interactions. There can be a drug-drug interaction, drug-disease interaction, drug-food interactions. M, mismatch. Mismatch between medication and condition of the patient. Efficacy. Efficacy is ability of a drug to produce a response. So if the drug is not responding properly or it is not giving the proper effect what was expected, and that also has to address. Next, farm. FARM. F, findings. It's a patient specific information, any kind of detail which is required. Assessment, what findings was there, evaluation of those findings, any kind of additional information, any severity, any urgency, any kind of short term goal, long term goal, anything. R, resolution, prevention, counseling, pharmacist recommendations. M, monitoring, follow up, safety, frequency and duration of monitoring. All these details will come in monitoring. The fourth one is SOAP Pharmaceutical Care Plan, SOAP. The first one is subjective. Subjective means patient. So it is all patient related, which patient only will tell. A physician cannot get it. The only thing is the pharmacist or physician can ask the patient and patient has to answer. It's a client feeling, the patient feeling and his reports. The patient is feeling headache, the patient is feeling nauseous, the patient is feeling nausea. Everything patient only has to explain. It includes the chief complaint for what the patient is coming, patient history, patient past history, patient past medical history, medication history, past any surgery happened, past any hospitalization is there, patient drug history, family, anyone is having the same kind of issues, social history, whether the patient is alcoholic or smoker, all these details will come in this subjective. Based off the subjective things, again the things which can be measurable and the factual data fact is objective. So objective things will depend on the fact, the vitals, the lab test, the imaging like scans, any medication review, any changes to the medication which is mentioned in the prescription. So all these things will come in objective. Based on the subjective and objective things, clinical analysis, the final assessment will be given. So this is the pharmacist analysis of any drug related problems based on his subjective and objective information. Last one is plan. So the treatment which only which not only include the medication, it also include the patient education, patient monitoring, patient follow-up, lifestyle changes, anything which can if any aggravating factors has to be avoided, those everything counseling things will come in this. So it's not only the treatment, it treatment and management like the monitoring also. Last one, I want to tell you this patient history taking, because for any kind of diseases, any condition of the patient, history is very important part. History play a very important role to explain the disease. So whenever the patient history has to be taken, we call it old cards, OLDCARTS, onset, where exactly the issue started. It is acute or chronic or in between. It suddenly started from the long term, the patient is getting pain. Location, where exactly he's feeling this sensation. Duration, how long it is. It is from 1 or 2 days, 3, 4 days, 1 month, on and off, how it is. Character, it's a burning pain, dull pain, throbbing pain, what kind of pain, aggravating and relieving factors, what is making it worse and what is making it better. If a patient is having pain after food, so if the patient is not eating food, or if the patient is having water, or if the patient is having any kind of cough, so if the patient is taking rest or taking any cough syrup, so whether it is how the pain is moving, so that is aggravating factor. Dust allergy or any kind of sometimes patient may get cough while walking also, or breathlessness. So these things aggravating and relieving factor. Timings, whether it occur every time at a particular situations, after particular situation, after walking, or how it is. Last one is severity. So 1 to 10 scale, the patient has to give a grading, how much pain the patient is feeling. So based off all these old cards, the proper history has to be taken, and which has to be correlated with the patient final condition and the laboratory investigation or any other object related things, which will make it easier to give a final assessment or a proper analysis of the patient. So for today, this is in this video. If you like my video, please subscribe, and if you want me to explain any other topic, please comment below. Thank you.